All right. Hey, good morning, everybody. Happy Friday, and welcome to our second technical assistance workshop for our school site specific plan. We hope that many of you, all of you, were able to participate in yesterday's public health discussion with Dr. Lisa Santora on guidelines 8 through 15. And so we're hoping just to be available to kind of go over those guidelines specific to implementation of the school site specific plan. So that's our goal this morning. And Michelle, can you bring up the presentation? All right, so we're gonna jump into guidelines 8 through 15, and what I want to say about the school site specific protection plan is this: just over the course of the past couple weeks, our team, our special education and alternative education team, have begun to develop and write the school site specific plan really for the fall for our campuses. And I've got to say, from the feedback from Janelle and Katie and Aaron, it's been a very, I would say, productive and encouraging process. It's been overwhelmingly positive when you're with all of your staff and going over each of the guidelines and how to implement that in your particular setting. It's been a healthy process, and we've learned that the most difficult questions are the ones that are the biggest opportunities to embrace and explore and discover and essentially find a way through to address the challenges that we all will face, but are specific to each site. So I want to just encourage everyone to go, when you're developing your school site specific plan, to do it with your staff, with a interdisciplinary group, and it's a healthy process. So next week, so we're going to follow the same pattern. We're next Thursday at 9 o'clock. We're going to go through the next guidelines 16 through 23, and we'll do a follow-up technical assistance workshop Friday at 10. And we're considering the possibility of combining the last two sessions, 16 through 30. We're going to discuss that more. We'll get information out about that, but we welcome you to join us. Okay, we can go to the next slide. So what our hope is just to spend a little bit of time on each guideline and address questions that came up yesterday that maybe weren't fully addressed, and or use the chat box, which I'm chat box challenged here. Okay, I can see the chat box now. As the workshop goes forward, that if you have specific questions about this guideline, to put them in the chat box, and I'm going to have Michelle and Patrick try to point them out to me. So the guideline number 8 is testing, and Dr. Santora gave us a pretty significant update and overview on the changing nature and current significant challenge of testing. We got an email last night from one of our district partners about the challenge they're having of getting in and getting tested. They're basically 7 to 10 days out right now, and the processing time for the results is longer than is ideal. But just on the way into work today, I was listening to a news report about breakthroughs in saliva testing and quicker turnaround, and this is in the state of Texas. But the testing the testing capacity and need is changing rapidly, and I know that our public health officers are doing everything they can to ramp up capacity and support the needs of our schools and essential services. So are there any specific questions on testing right now? I mean, I know that the intent, as it states here, is that all school staff will be tested at the beginning of the school year, and at least every 2 months. There's been a call and a need for you know, maybe more frequent testing by some staff. We've gotten some input, but we'll take that. Any questions on testing right now?
Hey, Mike, do you want us to do this through the chat or go ahead and unmute ourselves and ask?
Either way is fine. We want this to be a discussion,
Okay.
and if the unmuting gets out of hand, then we'll mute everybody. But go ahead, Marcy.
Okay. I guess for us is I'm fine. I get it. You know, what's going on with the lack of testing and the ability to get appointments and all that stuff. So that part I'm okay on hold with. My bigger concern, I guess, is if we don't do the testing to start the school year, but yet once we start the school year and either a staff member or a student exhibits symptoms, and based on another one of the guidelines around the screening, and if they're to be sent home, then how do we shut down a cohort for just 14 days if they haven't been able to get tested? So it's more not about the initial testing, but more about what happens if students or staff start exhibiting symptoms, but they can't be tested.
Sure, and that goes to what Lisa was talking about yesterday. I forget, she categorized the testing, I think, into 3 buckets, and I don't have them memorized, but I think that the urgency of symptomatic individuals is higher up the priority list. So I suspect that if a teacher or a student was exhibiting fever, chills, all the symptoms, cough, that they would be expedited. Is my understanding, and then we would follow the protocols, that we have in place.
And Mike, there's a few questions here. Will students that are asked to get tested because of their symptoms, scenario where cohort is not shut down, have to show proof of a negative test in order to be able to return to school?
Yeah, that's a great question. And really, all I can say is that we'll follow public health's guidance. I suspect so. It's like, I would say on a pragmatic, common sense approach, that would make sense. But there's HIPAA and confidentiality and things, but there will have to be some process by which a student or a staff member returns after developing symptoms, whether they're tested or not. And that's going to unfold with the support of public health.
Hey, Mike. This is Doug.
Hey, Doug.
I have a question. If a student tests positive, there's no way that the family has to sign a waiver to allow public health to give us that information, or for public health to give us that information. Okay. And so that's a challenge that we might not get that information from them, and they're kind of backlogged also. So if they're tested and they are positive, they could come to school and we don't even know it.
Yeah, you're right, Doug. And so again, this will be in public health area of response. So, there has been some discussion about kind of a structured strategic, it's outlined here, include testing of students with appropriate parental permissions obtained in advance. So, we have a template letter, permission slip that we did because we had some testing here at MCOE, and we wanted to involve Marin's Community School students and their families who were here for the summer. So we had it already, but it just didn't come together in time. But there may be some additional language to that permission slip that says something like, if the student tests positive, public health will notify schools. You're right. That needs to be fleshed out a little bit. But my sense is that public health, basically overrides HIPAA or confidentiality in certain circumstances, and this to me would be one of the circumstances. But we'll get clarity on that. It's a good question.
Yeah, because I can talk offline, but we are very experienced. We had some interesting findings when we tested last week before summer school.
Uh-huh.
And the whole process and how the parents were communicated to or not by public health. Yeah. So there's some, I get it. They're overloaded, right? There's not enough people in Department of Public Health to take care of everything as quickly as maybe we want.
Yeah, well, they're building. I want to, we've been assured that they're building out a school response team that's going to be fully focused. Lisa's going to have a team of people that are fully focused on school response, and they
Okay.
get it. That's a priority, not just for us as the schools, but for our community.
Great.
And so, we have had experience, through our pop-up childcare that has helped inform the protocols as they stand, and I know that they'll need to be tightened up as school begins opening. And I think once the testing strategy is defined, it will lead to additional steps that need to be taken just for making sure there's good communication in the event of a positive test.
Okay. Thanks.
Okay,
And
so
Mike, we have another question here regarding testing.
yeah.
Would you recommend that we start the testing process now for our staff, since there are significant lag time in scheduling and getting results?
Well, yeah, I mean, I guess here's what I want to say. That's a good question, and it wouldn't hurt. But the downside of that is that it's a point in time. So here we are, July 10th. If you were lucky enough to sign on today and get a test scheduled for July 20th, and you tested negative, well, we're still a month out from school starting. So we're trying to have it scheduled as close to the startup of school, but allowing enough time for the processing and results. So it's a fine line. But I had a personal experience of signing up. This was a couple weeks ago, and I got it the same day. But that has now been backlogged based on feedback we got just yesterday. They're about 7 to 10 days out just to get a test. So it couldn't hurt, and it's a good experience. It's a good process to get to feel what it's like to have that thing up your nose. And anyone who wants one, I would say go for it and see and let us know how it goes. Okay, let's go to the next slide. Next guideline. Okay, guideline number 9. This is the protocols, and this is available on our website. It's got links to template letters to parents, and I think that there's been some feedback that people are having a hard time downloading the guide so are you trying to download it right now, the exposure control ones?
Well, I'm happy to download any, but I just wanted to share that this is what our website does look like with all of the documents.
Yeah, that's great.
And actually we did test it with multiple people, and people are able to download all the documents just fine. So
that's great.
All good. It's all good.
Okay, that's great. So yeah, so the exposure protocols, again, we're at the point now where our staff are fluent enough with them, where just earlier this week there was a situation where someone had symptoms at home, and the school person, staff member, called our program director and said, I think we've got a scenario 2. It may be a scenario 1, I'm not sure, and what do we need to do? And all of it was right there. So the more you can familiarize yourself with these protocols, so that when it happens, the quicker we can respond. I think the most important thing is when you get to a scenario 2 or 3, that your reporting documents to public health are ready to go. And this is basically an attendance sheet and a tracker of who's in what cohort, what teachers working with what kids, so that if there is a need for isolation, that it can happen quickly. Any questions on this? Patrick, are you talking?
There's a question. Can you clarify? It seems like number 3 and 4 are in conflict with one another regarding what happens after a negative test.
Yeah. So this is something that we debated for a while and got public health's input. If scenario 1, 2, or 3 happens, and then if you send a letter home, for example, hey, parents of cohort number 3, we wanted to let you know that a student or staff member in our cohort has been in contact with a COVID positive person. They have been isolated at home. The cohort remains open. We'll keep you informed if there's any further information. And so then that student or staff member gets tested negative. There's a need to do a follow-up with the parents, and to say, hey, we wanted to let you know that the student or staff member in your child's cohort was tested. The test came back negative. That's based on public health's input. They're taking the following steps. They may stay out for 14 days, depending on the level of contact that they had, or they may be coming back in, but we just wanted to inform you. And then so I guess, there are probably 10 different outcomes or more that could come the scenario for, but it's a follow-up letter. We feel it's important that if parents are notified for any reason of a situation, a potential exposure, or even someone being symptomatic, that there's a follow-up call. So, we may end up having 3 or 4 versions of that template letter, but we don't see a conflict. We feel like the most important thing is to over communicate probably at this point. That's the way. During the pop-up childcare, every time someone had a temperature or went home, we would tell everybody. We would put it out to the whole group. That's not the case now. Scenario number 1, there's not a letter that goes home. I hope that makes sense. Okay, do you want to go to the next guideline? So physical distancing. So this is this is one of the most lively debated guidelines, but it is our guideline. And so I know that we got an email from a staff member at one of the schools in Novato saying that they have gone through all of their classrooms and measured out both 4 and 6 feet, and they still can't, in some of the rooms, they still can't have a standard size classroom. Well, I guess that's actually, I'm jumping ahead to the next one. But are there any questions on this? I feel like we've gone over this so often with public health. If it's 6 feet, if it's doable, 4 to 6 feet is permissible. Are there any specific questions on this? Okay. We'll go to the next one. So this is the one, the elementary school. So I think it was a teacher, or maybe it was an administrator at one of the schools in Nevada, said they've gone through, they've put down tape, and some of the elementary schools still could not get a standard class size. So that is what it is. If you can't fit it, there's a point in time where you can remove couches and tables, and do you want to go to the point of removing bookcases, or just to declutter, streamline, so it's just students and desks and the teacher, as much as possible. That creates more floor space, more physical distancing. But at a certain point, there's only so many square feet in a classroom, and that's what you have to work with. So then you have to go to some of the other guidelines about utilizing outdoor space, utilizing non-classroom instructional areas, and creating logistics where you can maximize the use of that instructional space.
One of the questions, Mike, that's coming up when we're having our conversations is around, so let's say that we're just one child space shy in a classroom.
Right.
So can we utilize the plexiglass partitions, for example? So let's say we have a table situation that the table is 5 feet long. We can put kids at either end of it, but that's not keeping them 4 feet from each other. Is it possible to utilize a plexiglass in between to allow the space to be closer, as long as those children have their masks on? Or is I guess we're having trouble figuring out what's the purpose of a plexiglass partition. Is that in lieu of, if you can't get the spacing, or can you talk a little bit about that? Or do we never?
So my understanding is that it's just another level of barrier to support concerns about transmission when you get less than 6 feet. But still,
does that mean we can go less than 6 feet?
Can you click back to guideline 10? So it's up to 4 to 6 feet distance is permissible between students.
But if, let's say, we physically can't barrier them 4 feet, and it's, let's say it can only be 2 feet. Is it acceptable to use a plexiglass partition in order to allow them to be physically separated, or do we need to maintain, and the plexiglass is only an added layer if we so choose to utilize that in addition to 4 feet?
Yeah, I think we, at this point, it's the right question, Marcy, but I think it's 4 feet still,
Good.
even
Okay, that's perfect. That's exactly what we needed. Okay.
even with the plexiglass. And, you know,
Sure.
and again, this all may change over time, but that's the way I understand it right now.
Perfect. Okay, great. That just answered the question. Thank you.
Great.
All right.
Okay, where were we? 11. Okay, that's elementary schools. Let's go to high schools. So middle schools and high schools, and this is another one that gets a lot of questions because how big is the larger cohort? Yesterday, Dr. Santora gave an example of 100 being kind of the limit. So if you have a high school of, you know, 1,200 students there, or a freshman class of 300 students, you're going to have to figure out a way to get them into classrooms and larger cohorts of 100. That's what I heard Dr. Santora say, and something that public health is comfortable with. And so how that's structured is a huge challenge. Everyone gets it. And we know that our high school teachers and administrators and staff will come up with best practices that nobody knows about yet, but that's going to be the challenge. And you know, and there are some other guidelines that talk about teachers moving from space to space that we'll address next week. But the idea is that each classroom has kind of a primary, like a homeroom teacher, cohort teacher, and then, but other teachers can come in and the students can go between the 3 classes. There are questions on that one? Okay. And again, we are encouraging our high schools and elementary schools to publish your plan and share best. I think that there's going to be some creative thinking that we need and will emerge in this opportunity that we have here. So the next guideline is 13, desks are arranged facing forward. I mean, this is pretty straightforward. We've had the conversation here that so much of the, you know, the collaborative, teaching students to work in teams and collaborative processes facing each other. And how can you set that up? So let's say you have a group project with 4 or 5 students. What's the best way to have those students be able to look at each other, face each other, have a conversation? And maybe it's you move them outside in chairs and have them, you know, 6 or more feet away from each other, or 10 or more feet away from each other, and have a group discussion about that. But this is a challenge. But the idea here is by students facing forward, they're minimizing the potential for transmission. And this is another place where plexiglass may also help to support collaborative student projects in a classroom setting. Okay. Guideline number 14, school staff are permitted to visit and instruct more than 1 classroom cohort, strictly following physical distancing and face covering protocols, and must document/record visits to classrooms that are not identified as their primary classroom cohort. So this is where, you know, the assistant principal can come in and talk to a class, or a principal can come in, or a music teacher or a math teacher or a history teacher can come in and provide instructional support for a class that's not their primary classroom cohort. But the key here is that they do maintain the 6 feet of distancing. They've got their personal protective equipment on, and there's got to be a documentation of what class they were in and when. And what I heard Dr. Santora say yesterday is, if I'm a teacher and I'm visiting multiple classrooms and I become a COVID-19 positive case, that likely all the cohorts that I have visited will be closed. That's what I heard yesterday. And that's fairly dramatic, but that's where they're going to start, I think, erring on the side of caution. Okay, guideline 15. Any questions on that one?
We have a question here.
Okay.
If we must maintain 4 to 6 feet, even with, hold on a second, I lost it. even with plexiglass per question number 11 or guideline number 11, how does this play into public contact with the front office or SLP, council office, etc.?
Yeah, so I think, you know, the front office is kind of a, what's SLP? What, anyone know what SLP, Doug?
Speech and language.
Okay,
So
yeah.
it's really, if we're supposed to keep 4 to 6 feet, even with plexiglass in a classroom,
Yeah.
as you mentioned, well, I mean, we're going to have a lot of contact with public and with students in offices and when students get pulled out for counseling or special ed programs.
Yeah, yeah. So I think that the you know the 4 to 6 feet is the case, and plexiglass, like what we I think that the office setting is totally separate. Like, we had to do some significant rearranging of furniture in our office at MCOE to maintain the 4 to 6 or the 6 feet distance in the office setting. And the office setting still should be 6 feet. We want to minimize the public. That's another, you know, I think that's guideline 29 or something like that, where we're minimizing non-essential visitors. The public should be minimized. But yeah, I would say that if a person comes in to check, say it's an HVAC control, you know, repair person, when they come into the office, they have some kind of agreement with the district or school that they're wearing masks, they're maintaining distancing, they're following all the health and safety protocols that are called for in the site-specific protection plan. And if they need a meeting in an office setting, then I think you still have the 6 feet distancing, whether you have plexiglass or not. Does that answer that question? Yeah, and then for speech and language pathologists and counseling, there's still work being done in that area. I mean, I think many people now have seen the humanity shields that we discovered last week from Public Health, and Public Health gave us a thumbs up on these, that this would be a reasonable replacement to a cloth face covering, and speech and language pathologists will use these, I'm sure. But there's also a recognition that some of the specialty one-on-one, you know, work with kids will be done remotely, and it may be the case that a speech and language pathologist has 1 or 2 classes they work with in person, and 3 or 4 or 5 other classes that they work with remotely. That's a scenario that I know our staff have been looking at.
And Mike, kind of on the same vein, so suppose a teacher is wearing a humanity face shield and wants to work one-on-one with a student only 1 foot apart. The way the guidelines are written, this would not be allowed. Is that correct? Or if a student is allowed to work with a student one-on-one less than 6 feet apart for a short duration, how short of a duration is it? Question mark.
Yeah, I would say it would not be allowed. And, you know, I know that, you know, we have special education teachers who have to, you know, toilet and diaper children. And, you know, there are times when there is more close contact is required. If a teacher is allowed to work with a student less than 6 feet apart, how short a, yeah, I think in general you should not work with a student. You should have your distance with them, even with a face shield on, is the instruction that we're getting.
There's another question here, Mike, about the escalation of COVID-19 in Marin, and what are the plans if this trend continues into late July and August?
Yeah, the plan is to do what Public Health tells us to do. I mean, there's just so, you know, what heard Dr. Willis say is that, look, 6 weeks in COVID time is years. So much can change, and everything, you know, we'll just follow Public Health's lead. In other words, they haven't given us if this then that, if that then this. We're just going to follow their lead and do what they tell us to do. And, you know, there's always, I've heard this morning again that some areas of our country are considering going back into a full shelter in place because of the high level of transmission. So we're going to take it a day at a time. We're going to continue our our support and plans for implementing site-specific protection plans, following these guidelines to get as many kids as we can back to school site-based instruction. And that's all we can really do at this point.
Is there a template for language to share with parents about not sending their children to school, even if the parents think it's just allergies?
Not yet. We've asked for that. So there's two documents that public health are working on. There's this exposure notice, potential exposure notice, like that you would get if you were exposed to measles or strep throat, and they're developing one for COVID-19. In addition to that, we are asking for a public health urging parents and school staff that the importance, it's always important to keep students and staff home if they're feeling sick. The urgency of that is incredibly magnified now with COVID-19 active in our community. So we're asking for a letter from public health with that urgency, and we hope to have that soon. Well, certainly before school starts.
If a teacher had a cohort of students for a week and then there was a week in between a cohort switch, would that be an acceptable amount of time?
Yeah, Bob, that is, in our pop-up childcare program, which again, it feels like years ago, it was a 2-week required turnaround, but now there's been some, I don't know the answer to that right now. We'll get that, try to clarify that with public health. But what I would say is that because teachers can go into multiple cohorts, I think it's acceptable as long as there's a good record kept. In other words, if during that time frame that you described, that teacher ended up developing symptoms and testing positive, that it would be trackable which cohorts that teacher was with at what time periods, and what cohort closures would be required. Okay. Yeah, so Ray, I want to, hi Ray, it's good to see you. And I see a comment about the important note of, regardless of when we return to school, we have to be prepared and ready when we return. So the work that we're doing right now is critical to the process regardless. So I think it's a really great point, Ray. And whether school starts on August 19th, which is our target date and what we're hoping for, we don't know what the world and our community is going to look like then. If we're back in full shutdown, well, maybe it's September 19th that we're going, or October 1st, or so whatever date we're ready for. This work that we're doing now about developing school site specific protection plans will help us. The other thing I've heard Dr. Willis say, it's not a matter of if we're going to return kids to site-based classroom instruction, it's a matter of how. And so what we're really focusing on, how can we do this in a way that does everything we can to ensure as much as possible the health and safety of our students and staff. That's the work. And the exact date that happens is not as important as the process. Okay, so we're at 14. School staff are permitted to visit and instruct more than one class. Okay, we already did that one. Let's go to the next one. Routes for entry and exit to the campus. This seems easy, but it may not be at certain campuses, and it's a break in routine. Like I suspect that at most campuses, typically everyone just kind of funnels through one or two areas, and now we're trying to maximize the number of routes in and out of the campus and strategically assign cohorts to use those routes. It's not that it has to be enforced. No one's going to get a ticket if they use the wrong entry or exit, but it's really to try to reduce and eliminate bottlenecks and large gatherings of people of students and staff as they come in and out. So that's important. This is probably just doing a facility map and walk through with your team and come up with, I think at Hall Middle School they said there were 6 or 7 when we did the walkthrough there. Any questions on this one? Okay, it's all of our guidelines. We got through all 15. Are there any other questions? Okay, how do we manage the substitute teachers? Doug, you have all the best questions, and so you know,
I'm only limiting it to these questions today. So
okay. Well, yeah, I feel like, okay, so I think you're jumping ahead. I think you're jumping ahead to I think that number 29, and there's another one.
I was thinking number 14. School staff are permitted to visit and instruct more than one classroom cohort.
Yeah. Okay. So yeah, and this is one that I know for our superintendent Mary Jane and for Dr. Willis is one that has to be really, really close. Addressed in a very detailed way because it's a huge issue, and we know substitutes traditionally have gone all over the county on different days, and that we don't see that being possible. So we're going to have to put some guardrails on how substitutes or specialists or coaches and people who aren't school staff who have typically provided support to schools, how we're going to regulate that. And so this is like our school transportation guidelines, like our testing plan. This is the other third area that we're really focused on, and we're working on it right now. But what we want is some consistency across the county and clarity. We're anticipating that sometime in the early August we'll be trying to support a substitute and specialist training for school support staff who've typically roamed the county and will no longer be able to, or will have to do so under very specific guidelines. But that's a big one.
Okay. Thank you.
Yeah. So Spencer's asking the ETA on the draft transportation guidelines. We have a task force that's been working on that and are working with. And we've got some recommendations to public health that are being reviewed right now, and our target date for release of those. I know it drives everything else for bell schedules and strategies for schedules. We're hoping by next Wednesday is our target, and that's our plan right now. We're shooting for I would say middle to late next week. Right now our tentative target date for release is August 15th, or excuse me, July 15th. Okay. All right, everyone. Well, you can see next week we have our upcoming health discussions and technical assistant workshops. We may collapse the two, guidelines 16 through 30 if we can feel like we can pull it off with Matt and Lisa, and we would do the same for our technical assistants. We'll follow the public health structure and schedule. We do want to have at the last one, it'll either be July 31st or the 24th, we'll have a general question and answer session, and we really appreciate everyone being here today, and hope you enjoy the rest of your day and have a great weekend.
Thank you very much.
Okay, thanks everyone.